Hi, my name is Angeline. The topic I chose for my signature assignment is psoriasis. We can begin by asking what exactly is psoriasis. And psoriasis is a chronic autoimmune skin condition that evolves in the form of recurrent inflammatory flare-ups, followed by periods of partial or complete remission. Now, there's a wide variety of risk factors and triggers for psoriasis. One of the major ones is a family history or genetic component. The HLA-CW6 gene is related to an early onset of psoriasis. Another risk factor for psoriasis is smoking. Obesity is also a risk factor, as well as certain medications. And some infections have also been shown to trigger psoriasis or to be involved in worsening of the psoriasis condition. These include having a post-streptococcal infection or having HIV. An AI model was deployed into an app named Skin Teller on the WeChat platform, which also uses a data set of 14,000 images from 2,000 patients with psoriasis. Results show the image AI outperformed experienced dermatologists with its diagnoses. Moving on to demographics. While psoriasis can affect anyone, certain groups are more susceptible. In the United States alone, about 2 to 3% of the population battles this condition. That's over 7.5 million adults in the United States. And from this chart, we see, this chart right here, we see with prevalence nearly twice as high among whites compared to non-whites, according to this analysis of a national survey data from 2011 to 2014. Anatomy-wise, psoriasis predominantly targets the integumentary system. The most common type of psoriasis is known as plaque psoriasis, and it's characterized by the presence of red, raised, itchy, and scaly patches of skin. The plaques usually appear on the scalp, in front of the knees, and behind the elbows. Less common types include goutte psoriasis, which are lesions occur in the form of small spots over a large area of the body. This type primarily affects children and young adults. Inverse psoriasis is when smooth patches of inflamed skin that worsen with friction and sweating. These are usually found in between skin folds. Pustular psoriasis is an uncommon form with pus-filled, non-infectious blisters. Erythrodermic is a rare but severe, potentially life-threatening form with widespread lesions all over the body. Psoriasis results from a problem with a type of blood cell, white blood cell, in the immune system called a T cell. These cells normally detect and fight off foreign substances. In psoriasis, T cells attack healthy skin cells and trigger an immune response. Blood vessels in the skin get larger. Other white blood cells enter the epidermis. The T cells release messenger chemicals called cytokines, which tell the keratinocytes to reproduce and mature much faster than normal. New skin cells form and move to the surface too quickly. They build up like as the thick, scaly patches on the skin surface, and that makes up psoriasis. And symptoms include red, scaly patches or skin itching or discomfort. If left untreated, psoriasis can lead to psoriatic arthritis and cardiovascular diseases. Diagnosis involves a thorough examination by dermatologists. In some cases, a skin biopsy may be performed. Treatment options for psoriasis aim to alleviate symptoms, reduce inflammation, and slow down the rapid growth of skin cells. Using ultraviolet light can be effective. For more severe cases, oral medication may be necessary to suppress the immune response. An AI image-based psoriasis severity assessment model has been proposed to automatically calculate the severity and extent of psoriasis in an efficient, objective, and accurate way. The Skin Teller app may be promising alternative for dermatologists, accurate assessment in the real world, and chronic disease self-management in patients with psoriasis. This is my presentation, and here are my references. Thank you for listening.